Hello, and thank you so much for tuning in today. I have Dr. Emily Splichal joining me today. She is someone in the healthcare industry that is helping people across the world walk better by focusing on sensation. Dr. Emily Splichal is a functional podiatrist and human movement specialist. With over 23 years in the fitness industry, Dr. Splichal has dedicated her medical career towards studying postural alignment and human movement as it relates to barefoot science, foot to core integration, and sensory integration. On today's episode, we talk about how sensation plays a role in foot drop and walking speed in MS, exercises to improve balance and gait, and vibration therapy. And if you want to hear more from Dr. Emily, check out Missing Link podcast episodes number 21 and 26. Dr. Emily, thank you so much for being here with us today.
Of course. Thank you so much. It's always a pleasure.
Yes, I'm so excited because I think this is your third time on my podcast, and you've also been in the Missing Link, my online program, as our guest speaker twice. So I think it goes without saying that I just love you and everything that you stand for, but
Well,
I'm excited to dive in.
thank you.
Yeah, so before we do, is it okay if I ask you a question from my interview deck?
Of course.
Awesome. Okay, just shuffling. Oh, they're upside down. Okay. Your question is, what brand or product do you buy because you feel it's trustworthy?
Well, outside of Naboso, just kidding, is I would say a brand that I associate trust. I'm thinking about my car. Car
Ooh,
companies put a lot of marketing and energy towards safety and then trust and longevity within the brand and what that brand represents. My car happens to be a BMW and they're very solid. They're like tanks. So I trust that brand.
that's great. That's a good answer. I have a Mini Cooper and I don't think they're that great when it comes to safety and whatnot,
But
but
they're
I really
cute.
like it. They
But they're
are.
cute.
Yes, it's got the white racing stripes on the front too. So it matches my vibe, I think.
Zipping around. Yes, I love
Yeah.
it.
Awesome. Okay. So if someone doesn't know who you are, let's just start there. Can you explain who you are and what you specialize in to kind of give us a segue into our feet and sensation, what we'll be talking about today?
Absolutely. So I am a functional podiatrist and a human movement specialist. And as a functional podiatrist versus traditional podiatry is I look at the feet from a very integrated perspective, how they are fascially and sensorily connected to the rest of the body. But I also look at the feet and movement as it relates to stress levels, diet, inflammatory. So really that combination of functional medicine and functional movement into functional podiatry. And then, in addition to that, I am the founder of EBFA Global, which is an education company that is education for professionals around the foot, barefoot science, foot to core. And then I am the CEO and founder of Naboso, which is a sensory based product line. I think the common thread of everything that I do is that I absolutely love movement. I think human movement is fascinating and beautiful. And I take a very much of a sensory based approach to assessing and optimizing movement.
I think that is so great. Everything that I stand for is related to function and functional movement, functional exercise, which I think is why we mesh so well together. And I think with multiple sclerosis, a lot of people and a lot of my patients struggle with foot related symptoms, whether it's foot drop or tripping, falling, not being able to climb stairs because they can't lift their leg high enough. But one thing that I think is related to all of these is without fail, people immediately go to the reason or causes could be happening is due to weakness or tightness, which it absolutely could be. But there's this other system at play, which is sensation, that so many people don't ever even think about. Can you explain how sensation in our feet work and why it matters? Because so many people don't even really focus on that. They just jump to other treatment strategies.
Absolutely. So when I talk about sensory and optimizing movement or reducing falls, things like that, is our sensory experience really relates to perception. So, awareness. Do you perceive? Do you feel? Do you see in your mind's eye your body, your feet, your foot placement? So, this sensory experience that I will refer to will be the entire body, but then you can get very specific to the foot and the foot ground relationship. What what is very important and that a lot of people don't appreciate or don't train or realize it's a function of the nervous system is that our nervous system, our brain needs to know where our foot is when we are moving without looking down at it. So, can you just feel it? Can you see it without literally seeing it with your eyeballs? Like, can your brain feel it and then see it? That then allows you to place your foot down. Let's say you're walking downstairs, and can you walk down the stairs without looking at your feet and where they are in relation to the step that you are about to step on? Or if you are stepping on a curb and you're kind of stepping up on the sidewalk, so that the way in which you contact the step or the way that you step up is accurate enough so that you don't misstep or fall. So, sensory awareness is very much interrelated with movement accuracy. And movement accuracy theoretically could move into like the grace or the elegance of how we move.
Wow, I think that was beautifully put. And so many people can't feel their feet. So many people with MS or any other neurological or neuromuscular condition don't have appropriate sensation in their feet, which could be where all of this stems from. If you can't feel your feet, you're probably not using your muscles correctly, which then could cause weakness and or muscle tightness. And so by focusing on strengthening or stretching exercises, you're kind of missing the whole cause that all this initially stemmed from.
Yes, 100%. And what I feel that there's two thoughts that come to mind. The first one is that most people, not even anyone who has a chronic neurological condition, MS, etc., but everyone or a lot of people in general are sensorially disconnected from their feet. So, what I often find is that we are starting with a lot of people who just don't have an awareness or are tuned in or were trained with that level of focus of the foot posture, foot awareness, foot placement. Then you add on top of that a neurological injury or neuropathy or MS, etc. And then that's where the effects can be actually larger or could be impacting movement even more so because you're not starting from a highly aware point and then you have neuropathy as an example. It's sensorially disconnected just from years in shoes and maybe not doing any sort of barefoot movement, and then you have on top of that. The other thing that comes to mind with that is that when we have less awareness, less movement accuracy, less of that grace and ease with movement, we actually work harder. So you're trying to almost overcompensate for the lack of the confidence in the movement, if that makes sense. So I try to have things be as effortless. And that's why I like to give like dance analogies and grace is that there is strength through relaxation in a sense. Like you want to be strong but relaxed, and finding that is a skill and a practice to do so.
Wow, that really hits home because I imagine from what you're saying that if you don't have appropriate or enough sensation to move smoothly, you're working harder and that can increase fatigue. And fatigue in MS is typically already present. And so this would just make it even worse.
Yes, and we become very conscious in our movements. And the more conscious that you are in movements, you obviously overwork, but the ability to correct quick enough and correctly actually slows down. So we want to be less kind of conscious and in our neocortex and movements and be very subconscious and trust the stabilization and reflex mechanisms of our nervous system, but that then relies on the basis of perception and being able to feel and connect to where that limb is in space.
So if someone is listening and they're thinking, I wonder if this applies to me, I don't know what my sensation is like, is there anything that they could do at home to kind of analyze on their own if what we're talking about applies to them or not?
So what I could do is give you a couple different exercises on how to connect to your, it's actually called body schema. So how to tune into your body, how to strengthen the mind's eye to the body. This body perception slash foot perception is that there's two ways. If you're going to do it just feet, then I have people shut their eyes because you want to really tune inward. And when you take away the visual system, it's just easier to connect to the physicality of the body. You can do it seated. If someone is really confident standing 2 feet with their eyes shut, you could do it standing. Otherwise, you could just do it seated. Feet are flat on the floor, no shoes, no socks. If you know that you have a neuropathy or a decreased sensation, you just don't know how much, you could pre-stimulate the feet and then do what I'm going to share. You could put your feet on a vibration platform. You could roll it on the Naboso ball, something to just kind of awaken the nerves. Then you're going to sit in the chair with your feet flat on the floor. Arms can be wherever they want, eyes are shut. And then you're just starting to notice the feet. And I have people start to just tune downwards and feel the sensation of the surface that their feet are on or that they're standing on. Maybe it's their kitchen floor. So, do you feel the smoothness of the wood or of the tile? Do you feel the temperature? So is it a little cool, the tile, right? So you're trying to just focus on these different characteristics. Do you feel all 10 toes? Are all 10 toes on the floor? Do you need to like give them a little wiggle to connect them a little bit? And then as they're sitting there still, this is a little bit more relevant if you're standing. But if you're standing, then I have people tune inward and see if they can notice if they have more pressure on one foot versus the other. Do we happen to notice it? This is totally subjective in our own experience. And then do we happen to notice if we have more pressure on the back of the feet, the front of the feet? Do we happen to notice if we have more pressure on the outside of our feet or the inside of our feet? So we're going through this different practice to feel what is technically your passive pressure. That's really the story of your foot posture, but it's also an exercise to then feel and connect to the feet. When I bring this into the entire body, which it can, again, can be done standing or seated, theoretically, is I would have people still have their eyes shut and I would have them start with their head and they would feel their head, obviously not with their hands, but with their nerves, and they would feel their head. And then as they feel the head, I want them to see it. So can they see the size and shape of the head? And could they connect to the amount of space it's taking up? And then, imagine in their mind's eye, they're going down their neck and then across their shoulders. And then can they feel how wide their shoulders are? Can they feel just kind of the shape? Can they see it as they feel it? Then they work down their entire body. And it's essentially an exercise to connect to the schema, your body schema, your mind's eye. And we are playing with sensation, visualization together. And then that can help to strengthen it. Physically, for the whole body, if someone has a hard time connecting to that sensation, you could foam roll, then do it. You could wear compression apparel and then do it. You could put a weighted vest on and then do it. You can kind of do things to turn up the awareness to the nervous system while they're doing this exercise to then make it a little bit easier to connect to them.
That exercise sounds meditative. It sounds like it could be pretty relaxing.
And it is. What's really interesting is there's research that shows the mind body connection decreases with age, but mind body connection decreases with various neurological presentations as well, stroke, Parkinson's, etc. But also things that we see in children. You have just a break or a less optimized mind body muscle, let's say. So doing exercises like this are really good to strengthen it. And that's my belief. When you look at research that shows doing yoga, Pilates, Tai Chi, there's so much research around Tai Chi for the active aging population and what it does towards movement accuracy, etc. And it's never directly mentioned in the interpretation, but to me, it is that you are strengthening the body schema in these practices.
Yeah, I mean, that just takes it to a whole nother level. And then when it comes to strengthening it consistently, not just kind of checking in with your body and can I feel these sensations or not, what approach would someone start with? Because I know that with Naboso. And if anyone listening doesn't know what Naboso is, I feel like I need to be a sponsor for you because I promote it to everyone. But I love it because there's different products that can increase your sensation. And some products you can wear all the time, like
Mhm.
insoles. Whereas other products, it's like a mat or something or socks where you can just use intermittently. So if someone realizes, okay, my body schema is off, I'm having a really hard time sensing this, where would they start to see an improvement?
I'll give an example of how I would strengthen it. And again, I like to do it with the eyes shut because there's something very powerful with the visualization. And there's lots of research around visualization of movement and that you do get motor neuron firing, you get activation of the muscles. So I've worked with people who have spinal cord injuries and I'll have them do things like this. But let's say we'll just do it from a sit to stand. And so I'm seated, so I'm safe and my eyes are shut and I'm going to just visualize. I'm going to see myself. I could either see myself like I'm in my body and then I see myself, doing this in my brain, like in my mind, or I could see myself and I'm like sitting there.
Like you're looking at yourself.
Yeah, like you're looking at yourself sitting or standing. So we kind of play
Okay.
with both because one might be easier for someone versus the other. And just as an example, that you could be seated, just feel your body if you can, hopefully, and then connect to it. And then just in your mind, see you stand up and sit down and stand up and sit down. And you're doing 10 really strong repetitions, right? And you just see it and just connect to that movement. That's a way that I try to do it. Another way that I've used in some concussion patients is that I will have them use like a wrist weight, holding the neural ball with the wrist weight, if that's something, because those are technically stimulating different aspects of the nervous system. And let's say we're seated again, just to keep that aspect safe. The eyes are shut. And let's say you're just doing a lateral raise, right? So you're just raising the arm straight to the side like this. And you have the stimulation in the hand and you have the weight, which is also stimulating the nervous system. So you can feel it easier. And then every time you lift the arms in your mind, I need you to see the arms lifting. I need you to really visualize and connect to the sensation of the arm moving. If I was guiding someone through it, every repetition, I would be saying, like, feel the texture in your hand, right? Really connect to the texture. And at the top of the lateral raise, as you see it, I want you to squeeze your hand harder against the texture. So I'm using my words to really use the sensory to drive the perception into the schema.
I was just reading a book about mindset, and it was referencing a study where one group of people visualized themselves lifting their fingers to get their fingers stronger. They didn't actually lift their fingers, it was just purely visualization. And then another group actually did finger strengthening exercises to lift their finger. And the group that actually did the exercise improved their finger strength by like 54% or something similar. And then the group that didn't exercise but just visualized improved strength by 35%, which was crazy, which goes right with what you're saying,
Yeah.
like the power of visualization.
I would be then curious of someone that either combines that every other day, they're either like visualizing versus doing it, or as they do the finger exercise, they're visualizing it at the same time, right? So those are two different ways to use visualization, right? Honestly, any movement that we do, and again, I like to shut the eyes because it forces you inwards. I remember when I was a trainer early on, and I was working with a trainer, I think it was like early 20s, and I was doing pull-ups. And when I do pull-ups, I shut my eyes just to like really feel it. And they were like, don't pass out, your eyes are shut. And I was like, whoa, no, you actually don't get what I'm doing. So
Right.
I would, especially if you feel safe in what you're doing, is to see how could you do with the eyes shut? Or could you just kind of look in the distance where you're almost like tuned out? You're not really looking at anything. So then really your mind is just focusing on the limb that's moving, that as well to connect to it. I love doing yoga entirely with my eyes shut. And if the listeners are doing floor work, that's a great opportunity to then shut your eyes because you're obviously on the ground. So you're in a safer position to start to play with it.
So, how does all of this relate to two symptoms that a lot of my patients struggle with, which is foot drop and walking speed, and maybe even walking endurance. Those tend to be two or three things that the majority of my clients struggle with. Can this type of visualization and sensory and body schema work help with those things, or would it also require an additional layer of sensory input?
Well, so for the foot drop, in the example of where I would recommend the Naboso socks and insoles. So the justification, let's say, to use Naboso insoles in your shoes if you have foot drop is that the insole is not going to take away the foot drop. It's not going to reverse it or strengthen the muscles so that you no longer have foot drop. But the way that I look at it is I want you to be very tuned into your foot placement, even more so because of the foot drop. So your movement accuracy requirements are higher when you have foot drop because you have just a weakened response within the muscular system, right? So foot accuracy and foot placement is even more important for that individual. Use something that will drive up the sensory stimulation so you can tune in easier to the foot placement. That's kind of the story or the justification for that. In the case of walking speed, one of the most important requirements for walking speed is balance. So if you don't know where you are in space and you're trying to walk fast, then you need one for the other, let's say. So what I will have people do to support walking speed is it has to start with sensory awareness. Do you have a connection of where your center of mass is as you are walking and taking each step? If you don't know where that is, you're going to slow down. And then as we slow down, we become very conscious and calculated in each step that we're taking. Fall risk goes higher. So they definitely feed into each other.
And what about endurance or stamina? Does that have the same approach as walking speed, where balance is one of the main indicators, or is that kind of a different category?
As far as is body perception and schema, is there an endurance to that skill? Is that what you're asking?
Yeah. Yeah. And do we need any difference in sensation for walking speed versus walking endurance?
Say that one interconnects with the other, right? Endurance is a subcomponent of the ideal walking parameter. So, can you walk? It's not even can you walk fast, where like my mom walks fast, but she does it for very intentional exercise thing, right? Where she's just like, she's booking it. Where really walking speed is not, I walk at this pace 30 minutes a day, every day. It's more thinking overall. So, what is the quality of your walking throughout the day versus this clocked in, clocked out speed that you're just trying to achieve every day? Does that make sense? That difference of
Mhm.
how I want people to look at it is to be intentful in the way that they're walking in every aspect of their day. It's a little bit difficult because the way that we walk around our home is very different than the way that we walk in the mall. I'm trying to think of a suburban way that you have wide open spaces or around the grocery store, right? So in modern cities and suburban lifestyles is that we do have to be very intentful of opportunities to walk faster because our home, the way we walk to our car, the way that we walk if you're around the grocery store are just very different. So I hope that answers the question of can we be more intentful in all of the gait, not just at a time.
And when it comes to balance, I imagine so you had said that balance is one of the most important indicators for walking speed. I imagine that having proper sensation directly relates to how much balance you have. Like if you can't feel your feet, your balance probably is not going to be too great. How do you approach balance exercises and what can someone do to improve their balance with keeping this whole mindset of sensation as our focus?
Yeah, and 100%. So perception of your feet is obviously critical to balance. And there was a interesting research study. I know that we're talking about MS, but it is a diabetic neuropathy research study that shows that if you have two diabetics, same age, but one of the diabetics has diabetic peripheral neuropathy, that individual will have a 15 times greater fall risk, which is huge. That's essentially showing how important perception of the feet is to stability and maintaining balance, reducing falls. So when I teach balance-based programming or how do we incorporate balance into our day, because people should be challenging their balance every single day, even if it's for 5 minutes, is that it does start with foot to ground interface. And what are you doing to build as much foot perception as possible? Take off your shoes, take off your socks, stand on a surface that is conducive to feeling your feet. Maybe that's a hardwood floor. I recommend a lot of things in the morning when you're brushing your teeth. So I would just say if you are standing on a bath mat, I would get off of the bath mat and I would go on the bathroom floor so you can feel the hard surface. Maybe stand on an Naboso mat so that you could feel the texture and feel the feet a little bit easier. Then the foot placement is very important. We can only balance as good as our base is stable, which is your foot. So your foot posture has to be set. So I call it setting your base. That you want to start with your feet shoulder width apart, and we will go on to one leg, but your feet are shoulder width apart. You're going to lift your toes, find your foot tripod. So first met head, fifth met head, heel. Spread your toes as wide as you can, place them back down onto the floor. Just those two things. You are increasing skin to surface contact and you are lengthening the digits. Now, a huge part of balance is actually your toes. So toe strength is really important for balance. You want them long, straight, and flat. If you have bunions and hammer toes, that's why I recommend toe spacers so that you can really lengthen the toes for stabilization. And then it might be a little bit hard to connect to, but you want to actually externally rotate the hips a little bit so you can kind of corkscrew the heel into the ground to lift the arch. It's just a way to set the base and get the arch in a stable position. From there, that's where I transition into, let's say, a single leg stance. When I teach single leg stances or balance exercises, I like to have the hip, knee, and ankle unlocked, so slightly flexed. A lot of people will do balance exercises and their legs are locked or extended. Think kind of like tree pose in yoga, where people are just on a very straight leg and then they're doing their tree pose. That's actually a very passive position to the joints and to the nervous system, and it's not transferring to the dynamics of balance during gait or walking. So I have people unlock their joints. It actually makes it harder to balance, and it's pulling in a lot more proprioceptive or neurofeedback when you unlock the joints. My goal is to aim for 10 seconds, and then I go to the other side and essentially go back and forth. And of course, there's many, many, many things that we can add on top of that.
Yeah, I think that knee locking is something I see super often, and I think that's such an important. I'm so glad you mentioned that because so many people don't even realize that they're locking their knee, or they do realize it, but don't realize how much it's actually impacting them as they are standing or moving and walking in general.
When we walk, an important part of how we absorb impact forces and just kind of break the impact of the ground, let's say when we are walking, is that we have to be able to flex our joints. And a lot of knee pain, where I have a lot of people who will say, I can't do squats anymore, it hurts my knees. I can't do this, can't do that because it hurts my knees. That's really telling people that there's a need for proprioceptive the neuromuscular component of knee stabilization is what we need to focus on. And that's also why I like to bend the knee in single leg exercises.
I love that. So far, when discussing multiple sclerosis and really anyone who has these symptoms, but ways to improve foot drop, walking speed, overall strength, especially in our legs and in our feet, we've discussed visualizing and body schema, some products, and I still want to get into exactly what Naboso is and what it feels like and how that works. And then you also mentioned vibration. I get the question all the time about what are your thoughts on vibration? What does vibration do? I feel like we could have a whole episode on vibration, but can you share, since you're the specialist in sensation and waking up our neural pathways, what does vibration do and is it helpful?
Yes. So vibration is one of the most important stimuli that we experience throughout our day. Where we experience vibrations is not just through our phone, but but every time you walk and your foot strikes the ground reaction forces or impact forces create and are perceived vibrations. So those vibrations stimulate the nerves, special nerves, and those vibrations wake up muscles. It makes your muscles contract. Vibrations build bone density. So that's part of how we maintain healthy bones is through walking. Impact-based activities create vibrations that builds bone density. So that's another great benefit to it. Vibrations are how your cells communicate with each other. So, vibration is a very rapid communication mechanism within the body and within the nervous system. In our feet, 70% of the nerves in the bottom of the feet are actually sensitive to vibration. So, that means that that is the most important stimuli that is coming in through our feet. I wish it was texture because that would be amazing for Novoso, but it's vibration. I am a big fan of whole body vibration platforms. It is a way to support nerve stimulation. It wakes up circulation. Like I said, builds bone density, can strengthen the foot and ankle muscles. If you are limited in your mobilization, I am a big fan of vibration based rollers. Vibration based rollers are really good because they cause a relaxation of hypertonic muscles. So when muscles are almost on like a spasm in a sense,
Mhm.
then using vibration will actually inhibit what's called a muscle spindle, which will cause relaxation. So it's a really good mechanism for that as well. I like to use vibration, let's say post surgery. Let's say you had a knee replacement. There's small little vibration massagers where you can essentially just paint the joint capsule around the surgical line, and you are just staying connected to the nervous system in a way you're talking the language of the joint. And that's how I think of vibration. It's one of the languages of our nervous system. Texture is obviously another language. Skin stretch is a third language of the nervous system. When I look at vibration, it's very specific vibration, meaning a certain frequency. Sound is also vibration. So when you tune an instrument, right, you're tuning a piano, let's say, you are tuning the frequency, which is very similar to what our body and our muscles do, is we tune into certain frequencies of vibration.
Does it matter if the person using the vibration plate is standing or sitting to
No.
get those benefits that you're mentioning?
So, no, I will have someone sit and put their feet on a vibration platform if they're not ambulatory, let's say. So,
Mm,
someone in a wheelchair, as an example, great. Someone post surgical, great. Again, it depends on the presentation,
right.
impaired balance, etc. If you stand up on a platform, you get vibrations further up the
Oh,
body. So that's where you would want to do it. They're not just foot specific. I'm very much of an advocate of vibration platforms without shoes. Obviously, if you have cushioned shoes on a vibration platform, the shoe is actually taking away a lot of that vibration. So you want to be hard surface, or we actually have some Naboso mats that we work with. One of the manufacturers of whole body vibration is PowerPlate, and we actually have a partnership with them, and they use Naboso on their vibration platforms. So you can actually get two different types of stimulation, vibration plus texture at the same time. That's obviously awesome for your feet and for your nervous system. You could be seated if you want. It's in small doses, so it'd be 10 to 15 minutes a day is really all you need to do. You don't need to do 30 minutes plus on a vibration platform.
I love that. What a perfect collaboration that is, both the texture and the vibration. That's awesome. Now, kind of moving more into the texture realm, that's really where Naboso shines. For someone who doesn't know what Naboso is, can you explain what it looks like, what it feels like, and the different types of ways that you can use it through the products that you have?
I have a small ball, and this is launching soon, pre-disclosed on this one, but there's tiny little pyramids across the entire surface of the ball. So if someone is just listening to the audio, imagine the inside of a sock, a flat insole, and there's these tiny little pyramids across the entire surface. And those little pyramids are kind of acting like braille. And we're actually stimulating the same nerve that your finger uses to read braille. It's a very specific touch receptor. So these tiny little pyramids are creating 2-point discrimination or texture, and then they're on a variety of products. My beautiful assistant over here. We have it on our kinesis board. This is a hand tool that we're launching. And as I had said, on the inside of socks and insoles, the same texture. We have a patent around that texture that it has demonstrated to then be targeted to these certain receptors. Oftentimes people are not sure or don't understand the specificity behind the texture, but similar to how I had explained the vibration, that it has to be a very specific frequency,
Mhm.
texture really needs to be a very specific distance or height. I would say probably the best analogy that people might appreciate is, let's say, like a medication. So you're taking a very specific dose dose of ibuprofen or Advil, right? That is based off of understanding the body, the science of the body, and how it uses that medication. We need a very specific dose, if you could say, of vibration, and then similar with texture. Then you're talking the language of the body, of the nervous system.
That's a great analogy because I can imagine that if people haven't listened to this episode and they don't understand sensation, what it really does, it might just seem like they're stepping on a surface that has tiny pyramids all over it. Not understanding that specific texture and sensation is actually activating parts of your neural pathways in your brain that can actually help with movement.
And it's demonstrated there are dozens of research studies around texture, testing different textures, which is part of how we came to the specificity of our texture. And then we now have actual research using the Novoso texture and demonstrating efficacy with one of them is MS. The MS Mendel Center just completed the research study. So they are going through the writing of the article to get it published. So it's really exciting to see that.
That's awesome. Can you share the website if anyone is interested in checking out any Naboso products?
Yeah, absolutely. So it is naboso.com.
Awesome. And I'll put that in the show notes too. But the final thing I want to ask you is about your upcoming book. This is just so exciting to me because I recently went through this whole process and I didn't know that you were writing a book, but I'm one of your biggest fans and will definitely be reading it. Can you share what is it called? What can we expect to learn from it?
So it's a lot of what we discussed on here as far as sensory stimulation, but it's called Sensory Sapiens and how sensory based movement unlocks longevity. My passion is obviously sensory, but my other passion is movement longevity and how to live a long life, movement has to be part of that story. And the quality and specificity of that movement is very important to unlock essentially the longevity aspect of it using sensory. So it is going into how our body processes sensory stimulation, how we relate to ourself, to our schema, which is your perception of your internal environment, such as your heart beating, butterflies in your stomach. So these different internal sensations and how that interacts with our external sensations, such as texture, vibration, seeing, hearing, joints moving, and then how all of that interplays into longevity.
That's going to be so great. One thing I think you are so great at is explaining something that is hard to see or that you can't see because it's more sensory in a way where we can actually visualize it and understand it. And I think that really takes a skill for sure.
Well, that is a huge compliment. So that means a lot to me. Thank you.
Yes. And I will put the link in the show notes. If anyone is interested in that book, then you can check out the link down in the show notes. But otherwise, I think that's all I've got in terms of my questions. Is there anything that you want to leave our listeners with in terms of motivation or an exercise or just something that you feel like they need to know?
Yeah. So, what I would say, and I always tell my patients this, is that when it comes to our feet, small little habits and small changes in the feet actually have a large, profound effect on the rest of the body. And those little tiny changes or habits are based off of consistent daily rituals that we do. Let's say foot rituals. It could be releasing your feet, it could just be using your toe spacers every day, it could be wearing the Naboso socks or do some of the balance exercises that I spoke about. But think about how you can consistently do something in a small dose every single day, because that will have a large cumulative effect on the entire body and your movement.
I love that. That's such a good reminder because so often those small things feel like they're not really making a difference. Awesome. Well, thank you so much for being here. And I'm sure we will have you back on at some point, but I appreciate your time with us and your expertise.
Of course, thank you. It's always a pleasure.
Mhm.